The teachers' unions have come out guns blazing on the Basic Education Ministry's suggestion to lower the social distancing requirement from 1.5 meters to just half a meter. Minister Angie Motshekga says the department's Health Advisory Committee approved the suggestion. Now, she says they've now come to convince Cabinet and the National Coronavirus Command Council to buy into the suggestion. For more reaction on this, I'm now joined by Hendrik Makanita, Deputy Chairperson and of the Foundation for Education and Social Justice, SADTU's Head of Secretariat, that's Xolani Fakude, and Mignon, McCulloch, the Chair of the South African Pediatric Association. Thank you all for joining us this afternoon. Hendrik, I'll start with you. Now, this proposed social distancing measure to half a meter, is it feasible during the wave?
Definitely. It is feasible. I think that the minister is on track. 0.5 meter, which is half of the 1 meter that currently exists, is feasible, and it can be implemented primarily in schools which are based in townships as well as rural areas where overcrowding is a major problem. And I think that the Minister of Basic Education, Mayor Angie Motshekga, has taken a very good decision, which will go a long way to improve education in our country, but also to minimize dropout rates, something that is already a challenge as we speak. Many of the learners have dropped out since the spark of COVID-19. And I think that the minister is trying to restore the quality of education because as we speak now, learners have fallen behind with the curriculum. And I think that once the 0.5 meter is approved by the National Coronavirus Command Council, it will certainly bring stability to the terrain of education.
Now, Mino, just off the back of that, the health risks posed by COVID-19 to children are seen to be much lower than the risks for adults or even teens for that matter. But talk to us about the feasibility of reducing the social distancing measure to just half a meter.
Sorry?
Mino, go ahead.
Okay, so we're living in difficult times, don't we? So we've learned a lot about this virus, and now that we've got the Delta variant, it makes it a lot more difficult. What we do know is that children are not as severely affected by this compared to adults, and adults tend to give it to children, not the other way around. Right. So when I heard Minister Motshekga speak, she said she was anxious about the reduction in the distance. We know the World Health Organization has said 1 meter is okay. There's just simply no evidence of anything less than that. But as everybody is saying, it's a risk-benefit ratio. You need to toss up the difference between children losing out on not only months of schooling, but years of schooling. Some kids get food at school, as you heard from the previous speaker. And so it really is a difficult situation. Can you have children with masks on, with teachers fully vaccinated, so not transmitting virus to the kids, in an orderly environment at school, and try and continue with the school curriculum? There's no evidence that 0.5 is okay, right. But what we're doing is we're looking at the risk-benefit ratio. So I can understand the anxiety from both sides of the fence. What we need to do is teachers need to wear their masks. People who are sick must not go to school, be they teachers or children, because we know this Delta variant is so much more contagious, especially in teenagers and adults. Primary school and ECD children are far less likely to get it seriously and needing hospital admission. They may get it, but they won't get it as seriously. And if you look at what happens outside of school, as soon as the kids leave the school classrooms, they run around in the communities and at home without a mask on. So difficult call, this one. Risk-benefit ratio, let's try and remain safe. Let's try and have open windows at school. Difficult in the Cape when you've got winter and rain, but we're trying to keep the kids educated, we're trying to keep them fed, we're trying to keep them safe, both psychologically and physically. So not ideal to have 0.5 meter. There's no evidence for this, but we can understand why people are saying this is a risk-benefit ratio.
Well, this is something that unions would agree with. Mr. Fakude, of course, we heard in my intro there that unions have come out guns blazing, some even criticizing this proposal. What has been SADTU's initial reaction to this?
Thank you, Nhlanhla. Firstly, let me greet you. Let me greet the viewers and the fellow panelists as well. And I can actually confirm that indeed you were correct in your introduction. Not only just SADTU, but SADTU and the 4 other recognized unions in the Education Labor Relations Council, we have come out quite very, very clearly to say that unless there is scientific evidence otherwise, to suggest that it could be safe for us and for our members and for our learners as well to be in the schools whereby we would have this significant reduction. Unless there is such scientific evidence, we are simply not going to agree to that. And let me tell you that the reason why we are so vehemently rejecting this particular proposal is because, firstly, there are key principles that have been ignored here. One of those, it is a principle of consultation, not just consultation for the purposes of ticking the box, but consultation for the purposes of really bringing along all the other stakeholders on board. Now, one must also mention that we get this report that there is this intention to make such a request by the Department of Basic Education. It comes hardly days after the DPE would have actually gazetted new COVID regulations that speak to 1 meter social distancing. It therefore cannot be correct that then suddenly, even before you go back to the very same labor organizations that you consulted, we then are hearing that there could be an intention to move to a 0.5 meter. What we are saying that we also have got the very same sense of urgency. We as teachers on the ground, we know what is happening on the ground, and we can tell you that our classrooms are not made of elastic. These are fixed structures. And we also know that in South Africa, generally, we've got a particular challenge, especially in the lower quintile schools, of an unfavorable learner-teacher ratio. Already we're dealing that even before this particular COVID. So what we are saying, and that is that there should be genuine consultations. We are saying that as the workers, we need to feel safe in the workplace. Remember that, by the way, even though about 89% of us might be vaccinated, the very same scientists and experts tell us that even though you are vaccinated, you are not necessarily immune. And by the way, our learners do not sleep at school. They actually stay at home with family members. Some of them are actually older family members. So these younger learners might actually be asymptomatic, but then they could still be perhaps in a position to actually transfer it to older people at home. So we are saying that we are all for normalizing the education system. We are anxious as educators, but we are saying that it cannot be done at the expense of the safety of our learners and, of course, that of our teachers as well.
Now, as we wrap up this part of our conversation, Mr. Fakude, I still want to continue by discussing with you the risks which may be associated with this daily interaction, especially if this proposal is actually given the green light.
Yeah, absolutely. I believe so, that what we need to do, Nhlanhla, is that should this be given the green light, what we have been clear as well, we've advised our members as unions. We've already said that where it is not possible to have this actually 1 meter social distance, not even 0.5 meter. We're not talking about that yet because we have not been consulted on that. We are saying that our members should, and education workers should actually utilize the deviation provisions that have been gazetted and therefore revert back to a rotational system, even though we know it is unfavorable. But fact of the matter is that we cannot want an education system that is normal at the expense of us, our health, and also our safety as workers and our learners as well.
Now, Mr. Makanita, I want to bring you back. You've said, or rather you've touched on the impact of rotational classes. I want to read a quotation here. You've expressed that there is no doubt that the rotational timetable has deepened the crisis of dropouts and further caused learners to fall behind the curriculum. Just please expand on that sentiment for us before we leave this part of the conversation.
Generally, learners are behind because of the impact of COVID-19. You'll recall that already in 2020, we lost the whole term. Mr. Fakude will remember as well that term 2, the entire term 2 of 2020, nothing was done in especially the township schools as well as poor communities. The learners who were able to carry on are those who are found in independent schools, the so-called private schools, because they were able to learn even under level 5 of the lockdown through online learning and teaching. But learners who come from poor communities have not been able to catch up during that time. So we are sitting here with an ongoing problem which has now escalated into the year 2021. As we speak now, it was a good thing that the minister introduced the rotational timetable in the beginning of the year. But if you look at the rotation, it is structured in such a way that learners come on a Monday. Let's say a group of learners will come on a Monday, and on Tuesday they stay at home. On Wednesday, they come back, and on Friday, they stay at home. This actually means that it will be difficult for teachers and learners to complete the CAPS curriculum as it is designed, for the year 2021. And this will create problems not only for this year, but for many years to come. And even for learners who may want to proceed into university, it will still be a problem. And I'm saying that if you go into schools and ask our teachers and principals, you will be told that the numbers are dwindling. There's a growing number of learners who are now dropping out of the system because of this rotational timetable. But at the same time, learners feel demotivated because at a time when they are taught on a Monday, by the time they get back to class, they have already forgotten what was taught in the previous lesson. And I think that my learned colleague from SADTU may agree with me that many of these learners use public transport, buses and taxis. And if you look at taxis and buses, there is absolutely no social distancing at all. In actual fact, there is it's just a 0 meter distancing, and they come to school. Not only learners but also some of the teachers as well as members of the public. So I don't think that, of course, we are not promoting what is happening in the transport industry, but we are saying that already we have learners, the majority of whom are exposed to no distance at all. And what the minister is saying, she's saying at least let us have a 0.5 meter distance, which is quite a very huge, gap between learners. And if needs be, we may actually have to find ways and means. There are companies already which are involved in the process of establishing cubicles. Perhaps the argument that should be raised is that how about if we find a way to involve the private sector so that where possible, they must come and install those plastic cubicles which learners can use so that learning and teaching can continue on a much larger scale than it is currently happening. I think that for many years to come, we will sit with this problem of, the curriculum that is incomplete, which will certainly affect our learners even in the future as they go into various fields.
Well, let's pause there for now and grab a quick glass of water, and we will continue our discussion on this proposal to reduce the social distancing measures to about ½ meter when we continue our discussion with our panel of experts shortly after this break. Do stay with us. Thanks for staying with us. We continue our discussion on the controversial suggestion by the Basic Education Department to lower the social distancing measures for school kids to just ½ meter. Now, joining us for this conversation is Hendrik Makanita. He's the Deputy Chairperson for the Foundation for Education and Social Justice, Xolani Fakude from SADTU, as well as Mignon, the Chair of the South African Pediatric Association. Mignon, I want to continue with you. Now, as children head back to school, parents may have questions about whether their families are at risk, and experts say that kids can develop COVID-19, and there have been cases where they've transmitted it to adults. What are some of the considerations that need to be made in this regard?
Thank you very much. And it's been very interesting listening to both speakers because they both speak with passion and they both have very good arguments. I think it's very difficult when we're in an open community now, when our economy is completely wide open. People are traveling around in taxis and transport, and they're working in the community. And so I can understand it from both points of view. We know ongoing that this condition does not affect children severely. So we know the Delta variant, children have had this. They can present in hospital, but usually they present when they've been with a broken arm or fallen off their bicycle, and they then get tested to go for a surgical procedure, and by the by, they actually then have COVID. So we have very few normal children, specifically kids under the age of 15, who end up being admitted for serious COVID. There have been a few that have been admitted if they've had leukemia or they've had very serious comorbidities. So it's a real balance between trying to not let these kids lose out on their education. Your previous speaker said 500,000 learners have dropped out already. That's an enormous amount, and we know that the rotational system is really not working for these kids. Another bit of research suggested that kids have fallen behind in 2 years. So if they're in grade 3 now, they've dropped back down to a grade 1. So we really need to get these kids back to school. For those who are dependent on nutrition, being on an alternate day feeding scheme really doesn't work. And so we need to actually look at, and where maybe we should differentiate between the high school and the primary school and early childhood development. So those kids we know are not transmitting it to the adults. And in any event, the teachers have now mostly been vaccinated. So they should be relatively safe. We can't, none of us, not any three of us and yourself included, can say absolutely you will or you won't get it. But once you've been vaccinated, your chance is far less. And we know this is not a condition like chickenpox or measles where the children are giving it to the adults. We know the adults are giving it to the kids. And what's interesting about Delta is that you may have very mild symptoms. So if you're an adult and you just have a stuffy nose or a very mild fever, you need to take that seriously, because that could in fact be the virus, and then you need to stay at home and not go to work, to school, and be tested. But we are worried that we have a group of children that are going to be a lost generation in terms of education, in terms of feeding and nutrition. And psychologically, a lot of these kids are taking a lot of strain. We're going to see more teen suicides and, in fact, physical injury as these children are running around in their suburbs, in their townships, on the pavement. We're seeing more and more children being involved in road traffic accidents and pedestrian vehicle accidents. So very difficult situation. I completely get everybody, but we need to get these kids back to school in a safe environment, in a controlled environment, everybody wearing masks, everybody's hand sanitizing, and as far as possible social distancing as best you can. But I think everybody knows that not all schools are going to manage 1 meter, and that is then the difficult part about what we're going to do about that. So this is not a virus that's going to be around only for another month or two. We're in this for the long haul, and realistically, we're probably all going to need a yearly booster to keep this virus under control. So I'm a pediatrician. My role is to look after children. I am concerned about their parents and their carers, but if you're asking me as a pediatrician, I'm worried about kids' education, nutrition, and their safety. And so we need to look at risk-benefit ratio and try and do what's best for these kids.
Mr. Fakude, in the same breath, I mean, we've just heard from Mignon there speaking to us about the symptoms of COVID-19, and while it is usually cause mild disease in children, it's really fatal. One basic way to help children protect themselves is to also emphasize the importance of hand washing, physical social distancing, and even mask wearing. Now, in your own observation, would you say there is a high compliance in our schools?
Thank you for that question, and perhaps before one quickly responds to that, maybe it is important to emphasize one point so that my fellow panelists can also understand where we're coming from as education workers. Now, it becomes for us quite unpalatable when our president comes and speaks and emphasizes on non-pharmaceutical interventions, which includes the very standard operating procedures that we have accepted. And by the way, a significant part of that becomes the social distancing. Now, we've got the president of the country telling us that, and then you've got the Department of Basic Education fighting for actually even reduction of that very same recommendation. We've got the World Health Organization telling us that we should see COVID infections in the context of the community. What happens in the community will most likely direct itself towards the school as well. So this is where our anxiety comes from. And also, I like what the Prof said, in that there is a lot of unknowns. Yes, indeed, and that's what we want to agree, that there is a lot of unknowns in terms of this particular virus. And these are the very unknowns that also causes that anxiety on our side as educators, and that is why it becomes important that there is a genuine consultation. It is quite important as well, in fact, that there is scientific evidence that is presented to us. Don't just give us anecdotal evidence, as it would be from political leaders who want to tick the box. You must then be understanding our frustration as education workers. However, moving forward in terms of how the compliance has been, it is different. It is different from one province to the next. We know that other provinces would have much more, a greater significant number of schools in urban areas that actually can be able to even handle some of these extra administrative burdens towards them. And then the reality on the ground, but when you go to the lower quintile schools, these are the schools in the rural areas, in the township areas. This 1 meter, in fact, on its own was just not possible. So now you even move away from this 1 meter, you are even reducing it even less. Now, last in Nhlanhla, our emphasis as a union is that we should not let this crisis pass us by as a country. We should really right now be talking about how we can make sure that we go back into the normalization of the system. Let us talk about those mobile classes, for instance. Let us get, like the Democrat said, let us get the private sector coming on board, for instance, so that we can be assisted with all of that. But however, what we are saying is that as much as we want to see normalcy in the education sector, because the burden is on us as education workers, it cannot be at the cost of our safety and a safe working environment, which is, by the way, a legal requirement as far as we're concerned as education workers.
Now, Mr. Fakude, I also want to speak to you about the anxiety and panic among teachers who did not vaccinate. Some saying that they are scared they might lose their jobs. But it's important that we also highlight here that the Education Department has said no teacher is compelled to get the COVID-19 vaccination. Give us some perspective from your members on the ground.
Thank you for that question. Actually, you would appreciate in fact that by now, when the sector vaccination rollout program ended, we had about 89% vaccinated, which is 417,000. Now, the rest that had not been vaccinated, various reasons were raised, some cultural, some religious, some even medical for that matter. And remember that as a union, as organized labor, it is us actually who fought to ensure that the sector is prioritized, because we really want to see it getting back to normalcy. However, what is important is for us to appreciate that vaccination is a human right after all. Just as much as it is the right to refuse to get vaccinated for one reason or the other. So what we are saying is that we are pleased with the fact that a significant majority of us in the sector actually did get vaccinated, which will assist us towards achieving that population immunity that we so seek. However, there is no education worker that can be expelled on the basis of not having vaccinated, because then that could be frankly unconstitutional and very on the basis of creating an unnecessarily catastrophic situation as far as we're concerned.
Now, Mr. Makinita, I'll give you the parting shot here. Unions are also warning the department that the 1 meter social distancing is not possible when all primary school learners return to school. What's your take?
Well, to be honest with you, our leader and comrade Xolani Fakude knows very well, because I know he has been in touch with many of the schools, particularly those in townships. Yeah. He already knows that learners themselves are already defying the protocols of social distancing. You go to many schools and you find that they are seated together in one desk, despite the fact that we are here, we have got protocols that we must observe. But I think that the key thing that we must talk about here is that learners are safer at schools than at homes, because already at homes, learners do not wear masks at all. But in schools, at least there is that enforcement, which is coming as a result of the teachers who insist that no mask, no entry. But if you walk in the townships, it is worse. There is no compliance at all. This actually brings me to the issue that Prof raised, the issue also of the meals. There are learners who may need to get meals at school, and when they are at home, department is unable to deliver those meals. But again, if learners are also members of the community. If you listen to parents as well, there is a growing concern from parents as well who want their children to go back to school. Already, as I speak to you, in the community of Mamelodi, there are many parents who are now signing a petition to say, let to school. There's a lady, a woman by the name of Cindy Petla, who is already leading the community of Mamelodi to organize women in particular, but parents in general, to sign this petition, which will see to it that the basic education must take all the kids back to school. But once again, we are also concerned about the growing number of learners who drop out. And I think that the department has got the opportunity with the 0.5 meters, they've got the opportunity to bring back many of the learners who have already dropped out of the system, as this will certainly go a long way to bring about the necessary stability in the terrain of education.
Well, there's lots to be said about matters relating to education in this country, but unfortunately, we have to leave our conversation here. Thanks to our panelists, that was Hendrik Makanita, the Deputy Chairperson for the Foundation for Education and Social Justice, Xolani Fakude, SADTU's Head of Secretariat, and McCulloch, the Chair of the South African Pediatric Association.